Hello, everyone. I'm Dr. Erin Katribe from Best Friends Animal Society, and today we're here to chat about feline panleukopenia. So first, a little bit of background. Panleukopenia is caused by a virus. It's in the same family as canine parvovirus. It is contagious, meaning that it's spread in between animals, and this becomes hugely important in shelters where we have lots of cats and kittens at once. This is a virus that affects primarily kittens, but also unvaccinated adult cats. And though we're going to talk about some of the earlier clinical signs, sometimes cats get sick and they can suddenly die even before we even recognize those earlier signs. And so this disease is the most common cause of sudden death in shelter cats and kittens. If you have a cat or kitten die suddenly in shelter care or in foster care, this should absolutely be at the top of your list of causes. How is this virus spread? Well, first it's important to note that cats can shed even before clinical signs start. So a completely healthy looking normal kitten could in fact be shedding this virus and be contagious. It's primarily shed in the feces, but viruses are microscopic. And so even if we pick up the obvious pile of poop, there still might be virus that's invisible remaining on that surface, and that could potentially infect another cat. And remember, if this virus is shed before signs start, that healthy looking kitten could be infected and be contagious even though they look totally normal. This virus is also spread through direct transmission, and so that means that when cats have direct contact with one another, they can spread it that way. And then it's also spread through fomites, and this is a really, really important one when we talk about this in the shelter setting. So fomites are just a fancy word for anything, any object that can transmit disease. So potentially that's our hands. We can track it on our shoes if that virus is on the floor, or if we don't sanitize equipment in between cats. We can also spread this through kennel contamination. So for example, an infected cat is in a kennel, that cat moves on. That cat got sick, we pulled it out to go to isolation. But if we don't fully disinfect that kennel, that virus can live in the cracks and the crevices around the bars, and it can live there for a really, really long time, potentially months. Fleas can spread this virus mechanically. So again, it's microscopic, but the flea can physically pick up those viral particles and spread that from cat to cat, or even through sneezes if cats have concurrent upper respiratory infections. So what are the clinical signs of this disease? Well, this virus, like I mentioned, it's related to canine parvo, and so the clinical signs are going to look a lot like what you might think of when you think of parvo in puppies. So the primary signs that we see are vomiting and diarrhea. However, it can also be a lot more subtle. So we might only see things like a decreased appetite or some lethargy. As I mentioned, sudden death is definitely sometimes the only sign that we see because this virus can progress so rapidly. The cats don't have a chance to show any of these other signs. And really, anytime we have a sick kitten, we want to have this disease on our list, and we want to rule it out before we move on to other things because the risk of transmission to other cats is so high. Okay, so we have a vomiting kitten or maybe a cat that has died suddenly in shelter care. How do we confirm? Again, as we talked about, this virus is closely related to canine parvo, so the quickest way to confirm is going to be with a parvo snap test. This test was designed for dogs, though, and so it won't pick up every case of feline panleukopenia. We can have infected cats that test negative, what we call a false negative. And so if you're suspicious of panleukopenia based on clinical signs, even if your test is negative, we still want to handle those cats with caution to avoid spreading this disease to other cats. What about treatment? How do we treat infected cats? The first and probably most important thing for the population is that we need to isolate those infected cats, meaning we put them in a special area where they won't risk spreading disease to other cats and kittens. When it comes to individual treatment, it's supportive. So we don't have anything that directly combats the virus, but we do have things that can treat the symptoms. Most important is going to be fluids. Because of that vomiting and that diarrhea, they can get profoundly dehydrated. They're nauseous, and so we can certainly treat that with anti-nausea medications. We will give antibiotics. So this disease is caused by a virus, but there are bacteria that normally live in the gastrointestinal tract. And these bacteria can spread to the rest of the body. when you have that compromised GI tract that happens with this virus. That spread of bacteria outside the intestinal tract, that's not normal, and it can cause body-wide infection and even death. And so that's why we treat with antibiotics, is to prevent this body-wide infection. We also deworm, so any concurrent issues that compromise their intestinal tract can make signs worse. And so parasites are really, really common in shelter cats and kittens, and so we want to just make sure that we're covering all our bases. It's also important to note that once recovered, cats are contagious for up to a couple weeks afterwards, and so we need to handle them with caution for at least that long. How do we prevent this disease? Well, the cornerstone of prevention is going to be vaccination. We do have a great vaccine that can prevent it in cats that respond to that vaccination. And so it's important to vaccinate on a shelter schedule. This means starting at 4 weeks of age, and we give an additional dose every 2 weeks. We keep vaccinating kittens until they're 18 to 20 weeks of age. So we start sooner, we vaccinate more frequently, and we vaccinate for longer than we do in a private practice setting. However, kittens do not reliably respond to vaccines, and so we never know when a kitten has actually had a chance to respond. And new intake adults may not have ever been vaccinated, and so for this reason, we have to handle kittens and new intakes always as if they could become infected and if they could actually already be contagious. Again, cats can shed this virus before they show any clinical signs, and so that healthy-looking new intake could be shedding this virus. What else do we have to do? We have to use gloves on our hands and either just throw a blanket around them or wear a gown to protect our clothing if we're holding those cats close to our bodies or moving them around the room. It doesn't do any good to use gloves if you're holding that cat next to your body. That contaminates your shirt. And so it is really simple. You don't necessarily have to completely gown up, but just put a blanket over them or over your body. Key points about kittens. The number of vaccines they've had does not matter in terms of how we handle them. Kittens may not respond to their initial vaccines. Maybe they do, and so that's why we start vaccinating so young, but maybe they don't until they're older, and we don't know at what age they'll respond. It's different for every kitten, and so it doesn't matter how many they've had. We never know when that protection kicks in, and so we must always consider kittens as vulnerable and also as if they could be contagious too, if they were exposed either before they came in or even unbeknownst to us while they were in the shelter. Okay, so what do we do if we know that a cat was exposed to another cat that was shedding this virus or was exposed to a contaminated environment? Well, the maximum incubation period, and incubation period is defined as the time from exposure to the start of clinical signs. So that maximum incubation period can be 14 days. It's usually less, it's usually in the 2 to 7 day range, but it can be as long as 14 days. And so if we know for sure that a cat was exposed, then we need to monitor them closely. And in the event that they do break with disease, we can prevent them from infecting others. And so that's exactly what a quarantine is. When we hold healthy appearing animals that have known disease exposure, waiting to see if they're going to develop disease. We do not recommend routinely quarantining all cats, only those where we know there was known exposure. Now, let's talk a little bit more about biosecurity and prevention. So again, biosecurity, it's important to wear gloves. And if we're holding those animals close to our bodies or we're moving them around the room, just gowns or even just a blanket over the top of them. And you can see that in this picture with the puppy. It's important to change those gowns or blankets and gloves in between animals or in between kennels. And if we're going into areas where there might be floor contamination, so for example, in isolation or quarantine wards with cats, it's important to wear shoe covers. What about foot baths? What about hand sanitizer? And the answer to both of those in the shelter setting, at least for staff, is going to be no. So foot baths are not effective at controlling this particular virus and with many pathogens, and they can actually be a source of contamination. If we need shoe protection, we should put shoe covers on. And hand sanitizer, also not reliably effective at this particular virus. This virus is really, really, really hardy, and hand sanitizer will not deactivate it. Our best option for sanitation is going to be rescue, although there are additional products that are effective, including WYSIWASH, trifecta, as well as bleach. But bleach can be challenging for a lot of reasons in the shelter. Quaternary ammonium compounds, what we call quats, are not reliably effective, even if the label says they are. So independent research has found them to not be reliably effective. And no matter what product we're using, it's important to use it at the appropriate dilution and contact time, and it has to be measured every single time. If we are cleaning a kennel in between different animals, we want to deep clean. But if a cat is remaining in their same kennel, spot cleaning is appropriate. And in fact, spot cleaning is actually preferred, and it's less stressful for cats. So if that same cat is staying in that kennel, just picking up the gross debris, cleaning out the litter box, that's all we need to do, and that is less stressful for that cat. As we wrap up, a few key points. Remember, all kittens and all new intake adult cats could be infectious, and we have to consider them vulnerable. They could become infected at any point. Anytime we have sudden death or sudden illness in cats in the shelter setting, think about Panleuk. Sanitation and biosecurity are hugely important, and we need to be vaccinating on intake and keep giving additional doses every 2 weeks to kittens and at least 1 additional dose to adult cats. If you are worried about an increase in disease or an outbreak in your population, reach out and ask for help. What's wrong with this picture? That's right, so no gloves, no blanket, and this is clearly a kitten, and so this kitten could become infected if this person's hands or their shirt front were contaminated, or this kitten could be shedding disease, and so this person could then become contaminated and spread it to other animals. If you need help, you have any questions, let us know. Reach out to us, the National Shelter Medicine team at Best Friends, at sheltermedicine@bestfriends.org. Thank you.